ways of not contracting HIV. You know, people have various misconceptions about HIV/AIDS. Now, you must know that HIV cannot be transmitted by insect bites, like mosquito or any other insect. It cannot bite a patient or somebody has HIV and bites another person. It cannot be transmitted through that way. Otherwise, most of us in Nigeria or Africa and most African countries, we have HIV as a result of mosquito bite. Sitting on the same, sharing the same toilet seat cannot lead to transmission of HIV. Even kiss, peck, the one I talk about, hot kiss, when a person with a bleeding gum is involved. Now, sharing of cutleries, using the same cutlery with a person cannot lead to the transmission. Then touching, hugging cannot lead to transmission of HIV. Of course, HIV does not inhabit in sweat, does not stay there. Now, let's look at the symptoms of HIV. Now, when AIDS begin to develop, there are certain symptoms that can show. Now, one is anemia, that is slow movement of, irregular movement of blood, and pale. The person will become pale because of lack of blood. Now, the person can have distorted or blurred vision as a result of it. Now, it can lead to swollen limbs of gland of the person. One of the symptoms is nausea or vomiting of the patient. The person will begin to vomit. Now, the person can have mouth, genital, or anal sores. Now, there could be chronic fatigue or depression or weakness. The person will become unexplainably weak. It can lead to chills. The person feel cold. Now, there could be shortness of breath. It can lead to that. One of the symptoms is loss of appetite. The person will not have this zeal to eat, will not like to eat. It can lead to nose, mouth, or genital bleeding. The person can bleed through these openings. There could be frequent diarrhea. Person use the toilet frequently. Dehydration, the person will lose water in the body. There could be tuberculosis or dry cough. It's one of the symptoms. Pneumonia and persistent fever or headache can also be a symptom of HIV. The person can, weight loss or emaciation can occur as a result of this as a symptom. Recurrent skin infections or rashes can also be a symptom. Excessive sweating at times of the night can be a symptom. Recurrent fungal infection on the mouth or throat can be a symptom of HIV. Now, aching muscles and the joints can be a symptom. Hepatitis B can develop. Then loss of memory, that is amnesia, can also occur. But you must know this. These are symptoms, but these symptoms are not peculiar to HIV/AIDS. No. The best way to know whether a person has HIV/AIDS is through tests. It is tests that will determine, not symptoms, because some of these symptoms can occur even when the person does not have HIV/AIDS. So you don't go and begin to stigmatize somebody that has any of these symptoms. No, the best way to know is through tests. Now,